This video will teach you how to perform basic life support. Basic life support is needed when somebody goes into cardiac arrest. A cardiac arrest is a problem with the heart's electrical system, where the heart beats irregularly or not at all. This is different to a heart attack where the heart muscle isn't getting enough oxygen. To help you remember how to perform basic life support, the mnemonic Doctors ABC can be used. Each letter represents a different step in basic life support, and we will go through each of these in turn. You may need to perform basic life support anywhere, but the most likely scenario is that you will be close to or at home. The first thing you should do before attempting to perform any basic life support is check for danger. It's much better to have one casualty rather than two. The next thing you need to do after making sure the surrounding area is safe is check for a response. There are many ways in which you can do this. Lightly shake the patient by their shoulders. If you know their name, you can call out their name in both ears to see if they can hear you. If the patient doesn't respond, then you need to shout for help. Next, you need to check the patient's airway. To check a patient's airway, you will need to perform a manoeuvre called the head tilt chin lift. Placing one hand on the patient's forehead and one underneath their chin, gently lift the chin forward to open up their airway. Next, you will need to check whether or not your patient is breathing. It may be clear that your patient isn't breathing, however, their breathing might be very slow, noisy, or even irregular. Because of the current COVID pandemic, it is advised that you do not place your face close to the patient's mouth. You can look and listen and place your hand on the patient's chest to feel for breathing. You need to check whether or not your patient is breathing for 10 seconds. If after 10 seconds you believe the patient isn't breathing, then it's time to phone 999 and ask for an ambulance. The first question the ambulance will ask you is whether or not the patient is breathing. If the patient is breathing, you can place them in the recovery position. However, if they aren't breathing, you will need to continue with basic life support. Because basic life support includes aerosol generating procedures, the current guidance given the COVID situation is to place a cloth on the patient's face. You now need to start chest compressions, which is commonly known as CPR. Before starting compressions, if anyone else is around, you could ask them to find the nearest automated external defibrillator, or AED. If you do not know where one of these are, you can ask the ambulance or use an app. Place your hands in the centre of the patient's chest. Interlock one hand over the other. Keep your arms and elbows locked in place. When giving compressions, you will need to push down at least a third of the depth of the chest. The rate of compression should be given at 100 to 120 per minute. This is about 2 per second. If help arrives, it is important that you don't stop compressions. Get the other person with the AED to work around you and place the pads on the patient's chest. The AED will have a diagram telling you where to place the pads. This diagram shows you where to place the defibrillation pads. It is a bit like a seatbelt of a car. Let's take this back to the beginning. Check for danger. Check for a response. Shout for help. Check the patient's airway. Check whether the patient is breathing for 10 seconds. If the patient is not breathing, you need to phone 999. Begin compressions. When help arrives, do not stop compressions and get the other person to work around you when placing the AED. You should only stop compressions for 3 reasons. The first, if the patient wakes up. The second, if help arrives and is able to take over the compressions. And lastly, if you are exhausted. Performing basic life support can be very tiring, and you need to keep yourself safe. We hope this video has helped you understand how to perform basic life support. Welsh Hearts is a charity that aims to teach the general public how to perform basic life support and raise money for defibrillators in the community. You can donate to Welsh Hearts through this QR code.